Hello, my name is Connie Boston, and I am the manager of the Senior Peer Program, which is a program at West Yavapai Guidance Clinic. The Senior Peer Program is a prevention program designed to bring older adults together. Our volunteers are age 60 and over, and as is the people they visit, we reach out to isolated, lonely adults. And in fact, during this time of the pandemic, there is so much isolation. I think some of our older adults are at last not feeling as alone about that. This presentation is designed to talk about the risks of medication uses, primarily prescription drugs, and the effect on aging bodies. I'm not a pharmacist. I'm really going to be talking more about risks and ways to prevent those risks. More than 80% of older adults between the ages of 57 and 85 use at least one prescription medication on a daily basis. More than 50% take more than 5 medications or supplements daily. And you can see there why our risk increases. About 25% use of prescription drugs are called psychoactive drugs, and they are taken for longer periods of time. Usually for older adults, the issues they help treat are depression and anxiety. Many medications can be lifesavers, but there are increased risks with multiple use. Here are some of the potential health issues. There's unintentional misuse, intentional non-medical use. There's more chronic illness in older adults dealing with pain, so they may be prescribed opiates. Age-related change in metabolism and how we metabolize our medications, and the potential for drug interactions. Research indicates that there is a rise in use of alcohol in older adults, particularly binge drinking. The combination of alcohol and medication misuse has been estimated to affect up to 20% of older adults. Medication interactions can also happen in combination with certain foods and supplements. Let's talk a little bit about access to prescription drugs. Prescription medication abuse among teens is at an epidemic proportion. 1 in 4 teens has admitted to taking a prescription drug not prescribed to them. Over 70% of those who abuse prescription drugs got them from friends and family. Medicine cabinets are easily accessible. This is where it's important to understand that grandchildren or other people who are visiting your home may be drug seeking, and you may be totally unaware of that. So it's wise to lock up your medications when not using them, or you have guests coming. The reasons for unintentional misuse of medications might include difficulties in reading and following prescription directions. Most of us can barely read them. Some of us have cognitive deficits. The cost of medications presents problems, and the complexity of certain kinds of drug treatment for certain illnesses. Medication management problems are different than misuse. We may be taking the wrong dose at the wrong time of day, or forgetting to take the medication, or the failure to read warning labels. Misuse of medications can include using a higher dose of medication than recommended, continuing to take it beyond the prescribed time limit, or sharing it with other people. Let's talk a minute about drug abuse in general among older adults. The spread of marijuana use and the opioid epidemic over the past 10 years have also affected middle-aged and older adults, although we typically hear about young people in that context. Prescription opioid and benzodiazepine misuse has increased older adults' risk for suicidal thoughts and accidental overdose, which often occurs with alcohol use. And keep in mind that older adults between the age of 75 and on have the highest risk of suicide of all. An interesting study was done about how older adults read warning labels. People over 50 seem to read warning labels less often than those between the ages of 20 and 29. Researchers tracked eye movements while people scanned the warning labels. Younger people actively scanned labels, while older adults sort of stared at them with a fixed gaze. All were tested following reading the labels. Therefore, those 50 and beyond did not see the phrase, "Don't take this medication and drive," etc. Older adults have more medications, and yet we're reading them less, especially with complicated dosing. So here's important things to know to prevent problems. Know what medication you are taking, why you are taking it, when during the day you take it, and what dose, how long you should take it, what side effects you should look for, what interactions can there be with other medications or supplements and herbs and food, foods and drinks, including alcohol, you need to avoid while taking medications. So here is some issues about why we react more to medication use and alcohol use. Our age brings about related changes in our body. There's a decrease in the percent of water in body weight, and this is particularly true for women. We have changes in how we digest. We have changes in liver and kidney function. We're more apt to have allergic reactions, and we're more apt to have chronic disease with multiple medications. And all of this contributes to a higher risk of interaction. Additionally, metabolism of alcohol by the liver. Alcohol is metabolized slower. Blood alcohol levels stay higher longer. Metabolism of prescription medications by liver or kidneys is slower. And mixing alcohol and medications can be deadly. Taking medications of other family members or friends can create serious problems. Drinking to cope with loss and isolation. And now is an important time to address that as we're sitting through COVID-19 epidemic. People are drinking more alcohol. Many are working at home, working remotely, and understandably more stressed and finding ways to cope better. You may find yourself drinking more alcohol, and you might find yourself having some more reactions to the alcohol. If you are, later I'm going to give you some ideas on how to assess whether that might be becoming a problem for you. Alcohol, remember, is a depressant, and even though we may feel better initially, ultimately it can increase depression because it depresses our central nervous system. Other medications, typically ones that older adults may be prescribed for anxiety, Valium, Ativan, Centrax, sleep aids, like Ambien, pain medicines, codeine, oxycodone, anti-seizure and antipsychotic medications. Alcohol also can increase symptoms of dementia when mixed with anti-anxiety or antidepressant medications. Here are some signs about warning you about alcohol and medication problems. Sometimes these are often attributed just to aging, and sometimes that's true by our doctors, but not everything is about aging. These can be symptoms of other problems, but pay attention to these. More memory loss when it's not gradual, worried or crabby, having trouble making a decision or concentrating, lack of interest, sad or depressed, mood swings, in trouble with the law, DUIs is one. More falls and bruises and burns. This is important for older adults because we are more likely to suffer serious injuries and even fatalities with falls. More problems with incontinence, headaches, dizziness, not taking care of our hygiene, and not eating well. We may be having trouble in our relationships with family and friends. We may be thinking more often about suicide, particularly if we're depressed. And we may have an unusual response to pain. One of the other things that research has shown us is that binge drinking is on the rise among older adults. And in fact, it's risen dramatically for older women. What is binge drinking? For men, the average prevalence of binge drinking was stable from 1997 to 2014. For women, it increased an average of nearly 4% per year. Overall, women are more sensitive to the negative health consequences of alcohol. Defining binge drinking is this: 5 drinks for men and 4 drinks for women within a 2-hour period. The recommended alcohol for adults is 2 drinks a day for men and 1 drink for women on a daily basis. But be aware that some health conditions and taking certain medications would indicate less or no alcohol intake at all would be the healthiest choice. Binge drinking has significant risks, certainly for falls and accidents, certainly if driving. But alcohol poisoning is not uncommon. And remember, our bodies are not processing the amount of alcohol as well as it did, and alcohol poisoning could potentially lead to death. Overdose combined with certain other medications is a critical issue, particularly certain opioids, but it may be true with other medications you're not aware of. So let's talk what is a standard single drink, because people often don't pay attention to that when they're saying they have 1 drink. So here's a definition of 1 drink: 1 can of beer at 12 ounces. You may have noticed that we Americans supersize just about everything, and 1 beer today is often a 16 or 24 ounce can. 1 single shot of whiskey or vodka, or what we call hard alcohol, 1.5 ounces is 1 drink. 5 ounces of wine, 4 ounces of sherry, and 4 ounces of a glass of liqueur. And again, this refers as moderate drinking to 2 drinks a day for men and 1 for women who are older adults. The Cage Questionnaire is something that was developed to help people take a look at whether they might be having some concerns with alcohol. They're simple questions and it's easy to score. So take a minute and think about these. This may not apply to you. It may apply to a loved one. Have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? Have you ever had a drink first thing in the morning to steady your nerves or to get rid of a hangover, commonly known as the eye opener? And keep in mind, when people close to us become concerned about their drinking, they typically are uncomfortable talking about that, so it's likely there is something to be concerned about. So here's how you score the Cage. Any item that has a yes answer indicates a higher indication of alcohol problems. A total of 2 yeses or greater is considered clinically significant and more serious. A positive response to any of these questions should prompt further explanation and examination. And at times, if you're very concerned, it's very important to talk to a physician. There are many herbs and other drugs that can impact your use of medications. And there's a lot of them. And the best choice for dealing with this and understanding it is to talk to your physician and also your pharmacist. For example, ginkgo has blood-thinning properties and should not be used with other blood thinners. Ginkgo and aspirin together may cause bleeding. St. John's wort, an herb that is sometimes used for depression, can interact with HIV and organ transplant drugs, and it also interacts negatively with antidepressants. If you are depressed enough to be prescribed an antidepressant, then St. John's wort in addition is not going to help. It's going to, in fact, make your antidepressant medications less effective. Some people use the kava herb for anxiety, but it can intensify depressants like alcohol, prescription sedatives, and it can increase liver toxicity. Double dosing on stimulants like bitter orange or cola nut and weight loss drugs, caffeine or pseudoephedrine, can speed metabolism, increase anxiety, heart rate, blood pressure, or insomnia. If you already have cardiac issues and high blood pressure, this would be a bad choice. The food mushrooms may counteract corticosteroids or drugs that suppress immune response. Herbal laxatives can deplete the body of potassium, and if taking diuretics, as many do, you may experience a double depletion of potassium. Psyllium or flaxseed do not deplete potassium. Some foods do affect how well your medications work. Avoid fish oil supplements if you take blood thinners. Large amounts can also thin blood. Avoid grapefruit and grapefruit juice if you take certain statins for high cholesterol or antidepressants called MAO inhibitors. If you take medicine for diabetes, avoid too much cinnamon. It can lower blood sugar. And if you take certain heart medications, avoid too much calcium. So how do you know what too much or a lot is? Again, consult with your doctor and your pharmacist. So let me give you some suggestions. It's always necessary to carry information about your current medications and supplements that you may take. For example, if you're in an auto accident or injured, this will help medical staff to immediately assess what is the safest way to treat you. Again, your best resources for information are your physician and your pharmacist. I have included a handout that you can drop down, and that will give you some suggestions shared by Consumer Reports of certain methods that make it simpler to keep access to your medications on your phone or your computer or by print. Never share your prescribed medications. Even though a friend may have the same medication, or you think that they have the same medical problem and it might be useful to them, it could very well be dangerous for them. You do not know what their medical condition is. Make sure your medications are not easily available to visit people in your home. And also remember to dispose of all medications safely. In the Quad City area, each police department will accept your prescription drugs as long as you've kept them in the original container. Thank you for listening to this presentation. I appreciate that you want to learn more about this subject, and I hope it's been helpful. Please stay healthy. Thank you.